behind because of the lack of health care that was either being postponed, denied, waived, whatever, versus our total focus on COVID. Dr. Fauci, I have watched a number of your press conferences, and I've seen you articulate a lot about COVID, but I've never seen you talk about this other part of the healthcare spectrum that we need to be considering also. Would you like to comment on that and give me your position on that, please?
Yes, I actually have commented on that when I've said, most recently talking about schools, that I think that a default position, despite the fact that we have to have flexibility, would be to try and, as best as we possibly can, in the context of the safety of the children and the teachers, to open the schools for the very reasons that I think you mentioned and that Dr. Redfield mentioned, because of the negative consequences on children from a psychological standpoint, as well as the downstream unintended consequences on families.
You know, one of the problems that we all have here on this committee is we're sitting here looking at the consequences of our problem that we have with COVID. We're looking at the consequences we have on not attending to the healthcare needs of the rest of society, and we have to sit here and figure out how do we manage this? How do we look at both sides of this? How do we, from 30,000 feet, make sure everybody is taken care of? In our position, what would you recommend, Dr. Redfield, on how we should approach this problem?
Again, I just want to echo what Dr. Fauci said earlier. We think that if you do 5 things, we can accomplish as much as we did as shutting down this nation. Wear a face covering.
All those things will be able to put us back.
We can put us back.
We address the other part of this as well.
We can get back without these unintended consequences. The face mask, the social distancing, the hand hygiene, staying smart about gatherings, and staying out of crowded bars and crowded restaurants. If we did those 5 things, we've done modeling data, we get the same bang for the buck as if we just shut the entire economy down.
Okay. You know, you've commented quite a bit this morning already on the school openings, and your comment was, you know, it's not about the economy or public health, it's about public health versus public health. I've got some grandkids, and I want them to go back to school. I think for their own health we need to be doing that. I think you've made the comment you have grandchildren. You'd like to see that happen as well. Would you like to comment on the other part of this again, the unintended consequences of the problems with child abuse that's not being reported, because most of it, a lot of it's reported by teachers. We've seen that go down. We've seen emergency cases in emergency rooms go up as a result of this. Can you comment on some of that, please?
Congressman, thank you. I just want to reemphasize, because I don't think I can emphasize it enough. As the director of the Centers for Disease Control, the leading public health agency in the world, it is in the public health interest of these K-12 students to get these schools back open for face-to-face learning. Mental health service, 7.1 million kids get it in school. Nutrition, we talked about. Reporting of child abuse, sexual abuse, mandatory in schools. The isolation that these adolescents are feeling that now is associated with increase, as you mentioned, increased drug overdose deaths and now increased suicides. I think it is really important. As a grandfather, 11 grandkids, I want these kids back in school. I have 1 grandchild with cystic fibrosis. I want it done smartly. Right? But I think we have to be honest that the public health interest of the students in this nation right now is to get a quality education and face-to-face learning, and we need to get on with it.
And one of the words I always use.
Thank you. The gentleman's time has expired. The chair now recognizes for 5 minutes Ms. Velasquez.
Thank you, Mr. Chairman.